In the past few decades, mental health has become an integral part of healthcare in Australia. Identifying the early onset mental health conditions has allowed for healthcare workers to better understand the importance of treatment, interventions and appropriate service delivery. The Access to Allied Psychologist Services initiative, more commonly referred to as ATAPS, is an Australian government program designed to assist mental health service delivery in our local region. Wentwest, Western Sydney's Medicare Local, delivers the ATAPS program in the Western Sydney region by enabling GPs in our region to refer vulnerable and financially disadvantaged patients to effective and free of charge services to local mental health professionals, who are also known as ATAPS service providers.
ATAPS is best geared for patients who have mild to moderate mental health issues. So that can mean any issues such as depression, perinatal depression, postnatal depression, child issues, but there are also specific groups whom ATAPS will cover.
There are a number of benefits for clients who are referred via ATAPS. Number one is that they get referred through their GP in the first instance, and that is a really excellent step because that means their GP knows exactly what's going on and they can support them throughout that process. The other big benefit is for clients who are having financial difficulties. The service is completely free. So it's great. It makes it much more accessible, especially for when people are in crisis and the last thing they want to be stumbled over is with the money side of things. And number three, because Wentwest has a number of allied health professionals geographically distributed, clients don't actually have to travel very far to seek professional assistance.
In Australia, we know that at any one time, 20% of people experience a mental health condition that impacts on their day-to-day lives. Generally speaking, services can be broadly differentiated into three areas. Number one, highly common conditions such as depression and anxiety affect approximately 9 to 12% of the population. Number two, people who may be experiencing these highly common conditions, as well as having social and financial factors impacting on the situation, affects approximately 4 to 6% of the population. Number three, individuals who experience rarer, more chronic conditions such as schizophrenia, which affects approximately 2 to 3% of the population.
What we often find when we talk about mental health needs is that there are probably three levels of intervention. We talk about mild, which is the people with having I suppose high prevalence conditions such as depression or anxiety, and they're often provided some assistance, usually via a system such as Medicare or Better Access. ATAPS is a little bit beyond what Medicare offers. I mean, it's structured similarly, but it's slightly different. What we find is that ATAPS works best with those people who have moderate levels of mental health issues or conditions. That's where I think ATAPS is geared towards people who have possibly high prevalence conditions, but they also have social factors that impact on them, A, to access help or secondly to also manage their conditions. So ATAPS is very much geared towards those people experiencing moderate levels of distress.
There's a few reasons why ATAPS is a useful add-on to Medicare's Better Access for Mental Health program. I mean, firstly, ATAPS actually does cover the full payment for ATAPS referred psychologists, which means that there is no gap fee for the patients, which is very useful for a lot of my patients who do come from lower socioeconomic groups. The second thing, which is often very useful for my patients, is the fact that the ATAPS scheme allows them access to a greater number of psychology visits. So the current Better Access for Mental Health allows a patient to have a maximum of 10 visits, whereas with ATAPS they could have 6 plus 6 and even possibly another 6 again, for a total of possibly up to 18 where there was a greater need for it. The fact that the patient is able to access this without any gap payments by themselves makes it very attractive and very useful.
ATAPS has really helped our patients with recovery because patients have access to 12 sessions of psychological therapy. The majority of clients get much better after the first sort of 6, and then if they do their second lot of 6, or if they need that, those gains are significantly improved and maintained. What I also find is that we provide in that time them with skills that they can utilise on a day-to-day basis to overcome the difficulties they come to us with initially. But the biggest benefit for me is that they're able to then take those skills and continue to use them outside the therapy room, which helps to maintain their gains.
How to refer. The patient and the GP together will discuss the patient's current conditions and living circumstances. They will complete a mental health treatment plan in the consultation. Please note, referrals for the ATAPS program must include a nominated and approved ATAPS service provider, along with the patient's consent. To assist in the referral process, please make sure all of the items on the referral form are completed.
There are 4 Tier 2 high priority areas. They include Aboriginal and Torres Strait Islanders, at risk of suicide clients, children aged 0 to 12 and perinatal clients. For Aboriginal and Torres Strait Islanders, they can be referred by Aboriginal and Torres Strait Islander Mental Health Services. For at-risk suicide clients, they can be referred directly through the hospital. For children, they can be referred by school counsellors, paediatricians, psychiatrists and social workers, and perinatal clients can be referred by obstetricians and maternal and child health nurses.
ATAPS is administered by Went West, and so all of the ATAPS resources, the forms, the information about it are actually available on the Went West website, and I find it easiest just to go there whenever I need to look up anything.
If you have any further questions in regards to the ATAPS program in Western Sydney, please do not hesitate to contact the ATAPS team at Went West on 02 8811 7100 or email ataps@wentwest.com.au.